Hi, English 220 classmates. My name is Melanie Bonifant, and I'm going to be doing this presentation on my white paper topic, which is meeting the sexual health and well-being needs of adolescents and young adults at the community level. When I say adolescents and young adults, I'm speaking about those people aged 12 to 24. And the community level, by that I mean not an urban setting where there's a lot of healthcare facilities, but more or less like a small village or a town or small community where there aren't a lot of options for healthcare. So there are unique issues that these age groups are faced with, and one of them is the high prevalence of STDs, actually. Between the ages of 15 and 24 in the United States right now, that's the highest number of people with STDs or having been exposed to STDs. So it's a real problem. Also, unplanned pregnancies are kind of an issue with women that are age 19 years or younger that are pregnant. 82% of those pregnancies were not planned. So another thing is intimate partner violence, or IPV. This is somewhat related to domestic violence. However, it's not only physical, it's also emotional abuse, psychological, financial abuse, those sorts of things that sometimes young people aren't even aware that they're in an unhealthy relationship. And finally, transportation barriers. It's often difficult to try to find transportation outside of a small village or a town. When you're in a young age group, say between 12 and 24, if you don't have a vehicle, you don't have a ride, and there's no public transportation, what do you do? And sometimes that actually means that nothing is done until a real issue a bigger issue occurs. So what can we do? It'd be great if we could provide a healthcare environment that's welcoming, safe, and free, and one that also takes care of the whole person and not just the one ailment that they come in for. But how do we do that? A couple slides back, we spoke about what the needs are for young people. At the community level, you'd have to figure out what those specific needs are for those within your community in those age groups, and then implement what's called a not-for-profit program known as a voluntary health agency. And then simply focus on the needs of those people in those age groups within your community and see what you can do to help. So who's going to do that, right? I say you can do that, or someone can help. But this is actually concerned adults within the community that are thinking about the health and well-being of those within the younger age groups, 12 to 24, and how they can help serve them within their community. It's a voluntary health agency is strictly a volunteer agency, so people of all different walks of life can come on board, from medical personnel to administration, marketing, cleaners, landscapers, all kinds of people needed for board members, clerical. There's truly a place for anyone in a voluntary health agency. So what would this agency provide? This agency can provide, as far as medical services, pregnancy tests, ultrasounds, STD testing, and treatments, and also potentially pregnancy options counseling. There's a whole lot more too. Other than just pregnancy options counseling, there can be IPV counseling and screening, accommodations in safe houses if that's necessary, clothing, food, community resources and assistance, continuing education programs such as GEDs, and baby diapers, clothes, etc. Here's just a little snippet of some pictures I came up with of a particular nonprofit agency and what they do. They have diaper drives, free therapy sessions, community resources, ultrasounds, GED classes. You can even have community service hours for the teenagers, high schoolers in town to come and help out, do community service hours so they can get those before they graduate. So what are the benefits? I think the main benefit is that the whole person is treated, not just the ailment. If someone comes in for a pregnancy test, realizes they're pregnant, they have options. And what they choose to do would dictate what you're going to do from there. And usually, if a person decides to keep a baby, then a mentor or a client advocate would move alongside that individual and just walk through it all with them from start to finish. And in most of these voluntary health agencies, they help with the child services and needs for the child, such as diapers and clothing and food, up through the second year of life. Could also benefit from the mentoring and educational programs, such as GEDs and prenatal and parenting classes. This can only provide education for community members that's going to enrich them, which in turn enriches the community as a whole. Lasting relationships can be formed, and a safe and confidential environment would produce more people coming back as repeat clients and patients. So it can happen, and I know that for a fact. I started working out at a voluntary health agency several years ago when there were only 3 or 4 of us on board, and we grew to a full-on medical clinic now, which we provide. Everything is free and confidential. I've seen the work done with individuals, say when I started years ago, and now their children are 8 years old or 9 years old or something, and we still talk to them, and they have still benefited from the time that they had at our center. And the center is Hope Clinic for Women in Southern California. It's just one of many voluntary health agencies, and it works. And so if you want to get involved and do this with your community, then hit up some other community members and see what you can do. So thanks for watching my presentation, and I really look forward to seeing your presentations. Have a good night. Bye.